Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today's episode is all about rethinking what's possible when it comes to pain, aging, and long-term health. I'm joined today by Eileen Kapsaftis, a chronic pain consultant with over 30 years of experience. She specializes in helping people reduce or even eliminate pain, restore function, and age without decline, often without relying on medications, procedures, or surgeries, which is absolutely amazing. So thank you so much. Welcome to the show. How are you?
I'm well, thank you. Thank you for having me. I'm excited to share good things and hope that your audience benefits.
Oh, I am so excited. You have such a powerful mission, helping people age without decline and living pain-free. And I think there's so many people that need that. I'd love to start with your story. What led you down this path?
Well, ever since I was a little kid, I always wanted to help the underdog. I always wanted to help people. I just hate it when anybody has any misery of any kind in their life and just want to help them and fix it. So that's just sort of been in my DNA. But when I got older and I wanted to go to med school, I realized I didn't really agree with the medical model. And
Mhm.
so I started looking at other avenues. I had always been very interested in nutrition, but I didn't really agree with what they were teaching in school at that time either. I'm kind of a dinosaur, been around a long time. And so the physical therapy program really intrigued me because I've always thought the human body was fascinating. And so I started there. But what really led me away from the typical conventional physical therapy model is I was introduced to a woman in when I was still in class who was extremely skilled at helping people to get out of pain. And I contacted her once I got licensed and asked her to aim me at the coursework that really helped people and steer me away from what would waste my time and resources. And she and I quickly became friends. She was my mentor for years. And I just was addicted to learning whatever would help people. And what I found a lot of the times was that people were being fragmented into parts, and you can't fix pain because you're not a body part, you're a whole person. And so, I don't want to get ahead of myself, but that I have found a lot
Yeah.
of very effective ways to help people when you see them as a whole person.
No, that's such a great view because unfortunately, it's not the common view in medicine. Maybe it should be, but it's most often not.
Yes.
I love that. So let's talk a little bit about chronic pain. Many of our listeners are dealing with conditions like pelvic pain, endometriosis, and other long-term issues. Why do you think so many people stay stuck in pain despite seeking care?
Yeah. So what I tell people is, when someone sees you as a body part, even if they just see you as a uterus when you walk in the door, there's a whole body attached. And so
Sure.
if they're not seeing you as a whole person, and I mean no disrespect, but they're going to be limited in how much they can help you because they're going to focus on that one body part. And because we have, multiple systems in our body, they all interconnect, they all act together. Nutrition plays a massive role in what goes on in our body. Everything we eat is either positive or negative. There's no neutral foods or drinks. And for the most part, the medical world doesn't really pay much attention to the food aspect. They also don't tend to pay a lot of attention to someone's, for lack of a better term, kind of personality. Some people are a little bit more hardwired to be more on the anxious side. Some people are more laid back. If you're somebody who deals with a lot of stress and anxiety in your life, medical issues are going to play a very different role. And
Agreed.
treatment really has to be more multi-pronged in order to help that person to really resolve the issues.
That is so true. I could not agree with you more. So, you talk a lot about aging without decline, which I think everybody would love,
Yes,
which goes against what many people believe, though. So,
yes.
what are some of the biggest myths that you see or
Yeah.
hear?
Well, in my book, Aging Culprits, I actually wrote about 12 different myths. I won't say them all now. But
Oh, nice.
I think one of the biggest myths, and this is because this has been fed to us through the mainstream narrative pretty much for decades, is that we are supposed to decline. And so people are expecting it. People are buying homes without stairs so that they can age in place. And what I've seen is as soon as they get rid of the house with the stairs, they decline at a faster rate
Oh,
because
wow.
they needed the stairs. I've seen people who 3 months after they got rid of the house with the stairs, they needed a lift chair to get out of their recliner because they couldn't
Oh
do it
my
alone anymore.
gosh.
So that decline is just rapid when you stop moving, when you stop exercising. And the issue is it really has nothing to do with age. And every single study I've read, and I'm a data girl. I bury myself in the data, and I've done 39 online events since August of 2020. And I do a lot of presenting to people. And so I always want to make sure that my data is accurate and I'm updated on things. And so I did a really deep dive into this whole decline thing, this age-related lean muscle loss thing that everybody talks about. And every single study I came across, and I read a lot of them, not everyone, I'm not that, it would take too many decades, but I read a lot of them. I could not find one that did not say this. They always said the subjects were sedentary. They weren't exercising, they weren't moving. And then when you came across studies of people in their 80s who did not show decline in muscle over like an 8-year period, they were actively exercising.
Oh,
So
wow.
it's not age-related decline, it's activity-related decline.
That makes so much sense. And it
Yeah.
really does, because you see, like the elderly that are very active and like outside or doing things, and you're like,
Yes.
you take it easy, but those seem to be the patients that actually like stay
Yes,
healthier.
yes. I had a home care patient once I was visiting, and his neighbor across the street, she was 93 and she was mowing her lawn,
Oh my.
with a push
Yeah.
mower. I mean, it
Yeah.
wasn't like she was sitting on a riding mower. So I've had people over 100 years old get stronger by doing squats and parallel bars. The human
That's
body is not
amazing.
designed on a cellular level to decline. It's not true.
It's a
You
whole new
can
way
grow
of
muscle
thinking.
no matter your age. You can increase the density of your bones no matter your age because it has a cellular response.
I love that. I really do. That's amazing.
Yes.
Um, I love that. So you use what you call a four-prong approach. Is that correct?
Yes.
So
Yes.
can you walk us through that?
So I've the first 15 years of my profession, I spent learning every manual technique out there that was effective at alleviating pain. And then I learned that it would be more effective. I started doing consults online long before the world shut down. So I was working with people all over the world, and I could walk them through specific movement sequences and figure out what wasn't working right. And so I found that if I can teach people how to fix themselves, that is so much more powerful. Teach a person to fish, right? Don't just hand it to them.
Yeah.
And so what I found is this four-prong approach could actually teach someone how to take control of their own life and how to move forward. And once they learn these tools, no matter what might happen moving forward, they knew what to do to address it. So the four-prong approach, the most important, well, I shouldn't say the most important, but a very important one is nutrition, which I've already mentioned. Very important to understand what the human body actually requires for health and
Mhm.
well-being and aging well. And there's a lot of misconceptions out there too, and most people are very confused. And there was actually a study that was done, and people said they found it was easier to do their taxes than to figure out how to eat healthy. And that's because of the confusion out there. So I try to be part of the solution and make it simple. I've got a YouTube channel. I just recently put out a video talking about the simplicity of eating well, and you don't need a PhD in nutrition. And so that's one of the approaches. The other approach is the movement. And the movement that I teach people is based on what I call authentic human movement. In other words, it's not the typical movements people will do in a fitness industry setting,
Mhm.
because most of that is isolating body parts, isolating muscles, creating stress to the tendons. I worked with a lot of people who had tendonitis who spent a lot of time in the gyms. And there's a reason for that. It's not how the body was designed. And I'll explain it very simply. If you go to put a suitcase overhead in the overhead compartment on an airplane, you are not worried about isolating your triceps. You're not trying to keep your elbows at 90 degrees and keep them next to your ears and only use your triceps. What you're going to do is you're going to use your whole body to lift that overhead and put it in that compartment. So you're going to squat down a little bit so that you can load your max, gluteus maximus, your power source. You're going to squat down a little bit so you can push through the floor and do that equal and opposite reaction the physics requires in order to put that load up over your head. So you're not isolating your triceps, yet in the gym, that's what we do. So what I teach people is how to train their body in authentic ways using all three planes of motion, and mostly weight bearing, because that's how we live our life. We don't really live our life laying on our back or laying on our stomach or sitting, ideally. And so that's the second approach. And then there are two other methods that I've learned that I have found can be very helpful, but it depends on the person because every person's unique like a fingerprint. So some people do better with a little more of this approach, a little less of that approach. The food and the movement is key for everyone. But there's two other approaches I use. One of them addresses the fascial system, and that's beautiful for people who have serious chronic pain issues that they've had forever, because it helps to give them a tool that can actually reduce their pain almost immediately as they're applying it. And then the other one is this fabulous method of treating opposite body parts. For instance, if a person has right knee pain, they're going to treat their left leg and very often improve the right knee function. So it's based on a lot of science, the opposites. It really, really works. I could go into detail, but I don't want people's eyes to glaze over. But that's really the four approaches. And it depends on the person. I have found some people need a lot more of one than another.
Gotcha. That's really interesting. I'm very intrigued about that. So for someone listening right now who feels overwhelmed or maybe stuck, what's one place that you would say they can start? So I think starting is always like the, challenging piece.
Yes, absolutely. So what I tell people is don't worry about stopping things that you know that you're doing that may not be best for your health, because that just stresses us out, and that stress puts us in that run from the bear mode, and now that's going to increase pain. It's increasing tension in the body. It's going to disrupt the digestive process. It's just not our friend. So the most important thing, I believe, is for people to add one or two things that are simple that they know they can do now without much stress about it. So one of the things would be as simple as making sure you drink enough water. Most people are dehydrated. Muscles are almost 80% water. You can actually experience muscle spasms because you're not drinking enough water. You can also have fatigue because you're not drinking enough water, joint pain because you're not drinking enough water. So just increase your water intake. That's a simple thing to do. I tell people about once an hour, drink a 4-ounce glass of water during your waking hours. A lot of people say, I can't drink much water. Well, most people can handle 4 ounces. And if you just do it once an hour while you're awake, you've drank all the water you need for the day. So it's very simple. And then another really simple way to get started is to just start moving. And in my YouTube channel, I've got one movement that I teach that is so gentle and so easy. And I've had people tell me that this has gotten them out of pain. This has stopped their pain. It's called a hip matrix. And all you do is stand and you rest your hands on your hips and you just very gently swing your hips forward and backward, just very, very gently. And if it hurts to go in one direction, focus more in the direction that it doesn't hurt. And just do that forward and back. And that's one plane of motion. And then very gently, just kind of shift your hips side to side. Pretend you're standing inside parallel bars and you're trying to tap them with the sides of your hips. And let your whole body be part of it. You might do a little bit of a side bend, but very gentle. And again, if one of those motions causes pain, don't do that one. Just do the one that feels good. The body learns from success. And then the last plane of motion is to just very gently rotate your pelvis. Kind of pretend you got a little flashlight in your belly button and you're waving it back and forth across the wall in front of you. Just a very gentle rotation, not doing any movement that hurts. Just that. If somebody has been sedentary a long time, they haven't moved, they don't know where to start, just doing that several times a day can make a huge difference in how they feel. And now they're ready to start moving.
Wow, that's amazing. That's very, very good, like a good starting point, I think. Like you mentioned, I think that's great. It's something that's like, I feel like it's like not or it doesn't sound intimidating at least.
Exactly.
A non-intimidating first step.
Yes, it's not going to put people in the run from the bear mode.
Yeah, exactly. So for listeners who are ready to take the next step in their healing journey, how can they find you and your resources?
Yeah, so I do have a lot of online content. A lot of it is free. I have my YouTube channel.
Nice.
I also do a lot of online events. So if they sign up for the newsletter, they'll be told when those online events are scheduled. But my main website might be people's best bet because there's a simple little 5-question quiz on there that takes less than 2 minutes to answer. And then that will aim them and list out the content that would benefit them based on their specific concern. And that's the website that is havelifelongwellbeing.com. It will really help them to know, okay, where do I go from here? There's too much to look at.
Oh, that's wonderful. So, Eileen, this has been such an eye-opening conversation. You're giving people something incredibly valuable, like hope, but also a roadmap. And it's not just like all this advice, but it's like, here's the first step, here's things like specific actionable items. And I think that's amazing. There's so many people that I can think of right now, our clients and our listeners that could benefit from this. So thank you so much. It was great. I hope that this conversation has helped our listeners feel more confident and that they'll reach out and actually utilize these resources. Thanks again and have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.